actually, again, dozens of types, but Hodgkin's disease, or Hodgkin's lymphoma, the most up-to-date classification is to call it Hodgkin's lymphoma and not Hodgkin's disease, because there was a period of time in our medical history where there was some debate whether or not it was actually a cancer, and that was debated for some time, but we now know that it is a form of lymphoma. We now know exactly what cell is involved, so it is a type of lymphoma. The reason that for a long time we had Hodgkin's and then everything else was non-Hodgkin's, and we've kind of gotten away from that now too. Our current classification is that we call all of these malignant lymphomas, and then under that are all the subtypes. One of those subtypes is Hodgkin's lymphoma. And the reason for that is that Thomas Hodgkin was the first physician many years ago to describe lymph nodes that were, actually he called them glands as well, that were not enlarged because of infection. When Hodgkin's reported this way back in the first part of the 19th century, when doctors saw swollen nodes, they were either from syphilis or tuberculosis. So what Thomas Hodgkin did was to look at them very closely and say, hey, these patients have something else. This is not an infection. And so and then about 10 to 15 years later, another pathologist came along and said, hey, this is, and they realized that Thomas Hodgkin had already described it. So then he said, this is Hodgkin's disease. So Hodgkin's didn't name it, someone else did, someone named Wilkes. And then it was 20 years later that true lymphomas were described. People were able to see that there was a difference between those and Hodgkin's. And so for many years we called it non-Hodgkin's and Hodgkin's. And now we call it all malignant lymphomas. And again, there are many, many different types of lymphomas.